I don't have autoimmune disease. I don't have cancer. I don't have, ulcerative colitis. They don't have any diagnosis, but they're like, maybe they just don't feel good. Like, I'm fatigued, I'm tired. And with those patients, you often find, I always tell people too, when I do a workup, we never come up empty.
Well, you do.
I will find something because everybody has something all the time. That's the trick. It's actually like, so you will find that everybody has something out of balance. Nobody's in perfect balance all the time. It's just a matter of how well we can balance these things out to really, make you optimally healthy today. And then we keep watching over time because it changes.
Welcome to the Warriors at Work show. This is Gina Coomber, your guide and host. This is a show for men and women in the workplace who want to move from the predictable to the potent. This is your weekly dose of inspiration with an edge. I talk with CEOs and shamans, sports marketing executives and therapists. All of us are like-minded thinkers and doers who tell stories, share wisdom, and challenge each other to have the best life possible inside and outside the office. Welcome to your Warrior Conversation. Everybody, thank you so much for being here with me. It's Jeannie, and welcome to the Warriors at Work show. Well, this is a very personal conversation you're about to listen to and watch. And I was motivated to reach out to these two functional doctors because not only have I been working with a functional doctor for a number of years, which has helped me really get out in front of my health, I started to scratch my head and wonder, why are so many people around me getting sick? What is going on? It's bigger than COVID. It's bigger than the pandemic. It's bigger than a lot of the limitations we've had to endure the last almost 2 years now. I really wanted to understand what else is there beyond the really important acute medical care, and thank God we have access to that. But what else is there? Is there more we should know about our energy, our bodies, our relationship to our symptoms? How do we listen to ourselves or not listen to ourselves? And why do we so often outsource it to other people to diagnose us? So I started looking around and seeing who are those people that are doing this work. And I had the amazing opportunity to meet and talk with Dr. Emily Rowe and Dr. Christopher Estes, their husband and wife, based in Miami. They're doing this work every day. They are medical doctors that left a traditional medical infrastructure, if you will, to create their own practice. And they talk about some of the coolest modalities that I didn't know anything about. But their philosophy is really how important it is to listen to your body, tuning in, listening, and advocating for yourself instead of giving up responsibility, which a lot of times we'll do. And working more in partnership with what your body is telling you and recognizing there's lots of different tools and modalities that are available to you to help you get back to your optimal self. So I thought this would be a cool conversation to set us up for 2022 as we're beginning a whole new year. And like all things that I put out here, this is in service to all of my incredible warriors so that we can have the best life possible inside and outside the office. So I hope you enjoy this. I hope this offers you some wisdom and some ideas to take back control of your health. Be well. Where I think it's really important to start is we need to talk about your path to medicine. So I'd love for you both to just take us back to the beginning. Why did you get involved in medicine in the first place?
Why don't you answer that first?
So growing up as a kid, I always loved science. I was a real science geek. My father was an engineer. And like for fun, he would teach me chemistry and physics. Most kids are out, Well, I did that too. I played plenty of sports and other things like that. But my time I spent with my father, I was learning science. but I also loved being with people and working with people. So I wanted to go into a field that took both of those things. So how can I do science and help people and be with people at the same time in medicine? It's a natural fit. So I'm the first doctor in my family. And I set off on the path, and I was accepted into an accelerated program right out of high school. So I got accepted into medical school straight out of high school, and that was it.
Wow. How about you, Emily?
So my path was a little more convoluted. When I was younger, I studied dance for years, and I had a lot of friends who were gay, and I was very concerned about some of my friends who were sick with HIV/AIDS. And this was in the 90s. I'm 45 years old, so this was in the 90s before there was like the drug cocktail or protease inhibitors out. And while I was in college, I was working at the Florida HIV/AIDS hotline, which answered questions about HIV/AIDS and stuff like that. And I was actually going to school. I was geared towards getting my PhD in what's called microbial bioremediation, which is when you use microbes to clean up toxic waste sites. So I worked with uranium daily in the lab for years, and we would find microbes that would munch up uranium or heavy metals in the soil. But while I was working in the lab and working on the hotline, there was one infectious disease provider for 7 counties, and this was in Tallahassee, and that person quit. And so there was a ton of people who were left without healthcare. And there was like a lot of discrimination at that time. And so at the same time, somebody who was a classmate of mine, who I thought was a moron, got into med school. And so there was like a conglomeration. I was like, if he can do it, I could do it too. So I took the MCAT, got into med school, and totally changed my path because I felt such a deep compassion for all my friends who were left without healthcare, a healthcare practitioner. And it's funny because through the convoluted journey, I mean, we treat a lot of chronic infections like Lyme, chronic Epstein-Barr, things that are not recognized by conventional doctors. So we're actually doing a bunch of infectious disease, wouldn't you say?
Oh, we do tons.
We diagnose a lot of parasites in people. So it's taken a lot of, it's been quite a journey. It's taken weird twists and turns.
Well, that's a perfect segue because I'd love for you to talk about, you both made a very conscious decision to shift from being in the systematized medical system into more of an integrated wellness practice. So tell me about the moment when that happened, and then a little bit about like the journey. I mean, that I would imagine would have been a very different set of experiences.
Well, and it's funny, we had our shifts at very different times.
Very different.
My shift was in 2005. I was working in internal medicine at a hospital that no longer exists called St. Vincent's in New York City. And I was doing a rotation on the ICU, and over the night shift, 7 people died. And that morning before I had to go home, I had to sign 7 death certificates. And I felt like there was a lot of medical futility. I felt like I wasn't helping people. I actually felt like it was medical torture to keep some of these people alive. And don't get me wrong, there are situations where people are in the ICU for short periods of time and then come out and excel and do well. But I wasn't seeing that. And I was prescribing things to people that I would never do myself. And I felt like, end-of-life care for my dog was more humane than what people were going through. And I literally couldn't do it. And so I literally quit being a conventional doctor. And I was kind of lost for about 3 months. And Chris said, well, you could be a housewife if you want to. And I was like, oh, that's not going to happen.
I'm going to do something. I was like, but I said, don't worry, please. If you're not happy now, I know people in medicine that are the most miserable doctors you'll ever meet in your life. I'm like, don't go down this path if it's not for you. So quit.
So, and at the same time, I was having horrendous joint pain, insomnia, all sorts of problems. And, nothing was diagnosed. Turns out that I had autoimmune disease for years that didn't get properly worked up. And so out of desperation, I went to an acupuncturist, and it helped me more than anything I learned in medical school. So after I quit, I went back to school and got a 4-year master's degree in acupuncture and Chinese herbs. And then for years, I limited myself just to acupuncture and just to working as an acupuncturist and Chinese herbalist. And then later I discovered functional medicine. I went back to school for functional medicine. And then as we worked through the layers of functional medicine and revisiting pathophysiology, and what functional medicine is looking at root cause of illness, finding the etiology. So for example, if a man has low testosterone, if you go to a regular doctor, they just give you testosterone. But I want to know why your testosterone is low. Are you eating more carbs than you can handle? Are you being exposed to plastics, which are like a fake estrogen and is messing something up? Are you drinking too heavily, which is stimulating the aromatase enzyme, which is, basically sweeping away all your testosterone? So that's like what functional medicine does. So, and then after we studied functional medicine, we had patients that didn't respond to that, including myself. So we started looking at root causes even deeper with toxins and also chronic stealth infections like Lyme.
So while you were going through this, Chris, you were still very much entrenched in the traditional medical community as an OBGYN. Were you kind of looking at her like, all right, you do you, I'm going to do me.
Yeah.
So tell us a little bit about that. And then when you were like, okay, you know what, I'm going to switch as well.
Yeah. Well, I was very excited when she went back to school for Chinese medicine and acupuncture. I was always a believer, like, okay, yeah, acupuncture is great. I've seen it help people, and I think it's a wonderful thing. I always thought it was great.
You were very supportive too. Anytime I learned something in school, Chris let me try it on him. Exactly. He was like, I have eye pain. I was like, oh, I learned a point for this. And I would like prick his pinky toe.
I used to have horrible acid reflux, and I'm like, she's like, oh, there's a point for that. I'm like, really? There's needles? She's like, yeah, it's in your foot. I'm like, okay. I'm like, yeah, put the needle. And like, she's like, puts the needles in. I'm like, oh my God, my acid reflux is gone. This is like a miracle. So I was very supportive, and I always referred people. And I mean, even when I was in the most conventional of my practice days, I would have a talk with patients sometimes where I don't have a pill for you talk, where it's like, yes, I know you don't feel good, but like I don't have surgery for you. I don't have a procedure for you. I don't have a pill for you. Like, it's just, it's not there. It's not, you're going to talk to specialists. They might do things, but it's not really going to help you. But I do have someone who's got a bunch of needles and herbs, and like that person can help you. So I refer. And then, I really saw people going around the medical merry-go-round, is like what I like to call it, because I worked at a tertiary care center for the University of Miami. I was on faculty there. I taught residents and medical students. I was a director of the clerkship. I was the director of, the undergraduate. That's the second year repro endo course. I did a lot of educational things. I gave talks at local and national level, all this sort of stuff. But I would be seeing these patients with all sorts of complicated medical illnesses, and they would go from like one specialist to the next, to the next, to the next. And like, maybe they would wind up with more diagnoses on their chart. Maybe they'd wind up with more medication in their systems, but they never really got better. So it was like, or worse, they just continued to spiral and get worse and worse and worse. And I realized, I need to learn more about what's underneath all of this stuff. And I realized that this is kind of a funny thing looking back. I became known as one of my specialties when I was at OBGYN was like, I was the guy who could fix anyone's vaginitis, which is kind of a funny thing to be known for. It's like, if you have a yeast infection that won't go away, no problem. You send them to Chris. And like, I figured out a lot of different little tricks and tools to help women get over chronic vaginal infections, which can be a major problem and very interruptive for people's lives and such. So like, and I realized looking back, like when I was doing that, I wasn't really fixing a GYN problem per se. 99% of the time, I was fixing a gastrointestinal problem. So I was fixing their GI tract. So if I fix your GI tract, all this other stuff gets better. And that was really my first aha moment that I said, oh, wait a second here. I'm actually practicing gastroenterology, not gynecology. And I said, but wait a second, these two things are so connected. And so that's part of my path when we got back and we started studying functional medicine through IFM. And then we followed the same path down, studying about Lyme and mold and other environmental toxins and stuff like that. And
Part of it too was your dad got sick.
And my dad got sick. Yeah, my dad had pancreatic cancer. He passed several years ago, but he got sick with pancreatic cancer. And I had a couple other illnesses in my family, and I looked also at the other chronic illnesses that people in my family had developed, and I could see myself in the very, very, very early stages of some of those things. And I was like, you know what? I'm not going to go there. Like I am not going.
You weren't feeling healthy yourself.
No, at that time I was quite unhealthy.
Chris has lost like 90 pounds.
Yeah.
And like you look at him, he looks like he was always thin. He wasn't.
No,
always,
I wasn't.
He was a heavy smoker.
I used to smoke like a pack a day. Not
a lot
very.
of physicians are.
OBGYNs are notorious.
Well, and
Used to be anyway.
For me, when I look back at my life, my least healthiest periods were medical school and residency. It was so physically stressful. The structure of how the education is set up is not geared towards the health of the actual practitioners.
Yep.
Yeah, so let's talk about that, because obviously you went through cancer, and I'd love for you to tell the story there, because I think that's also really important to highlight. Not only your relationship, the importance of how you both interact with each other as healthcare practitioners, husband and wife, but going through a very serious life challenge, and how you were able to really immediately apply what you were learning and practicing real time to help yourself.
Sure. So in 2017, I was feeling bad. I was feeling really bad. And I had a lump in my neck that I could feel. And I had Chris feel it. I was like, honey, I feel something here. And he felt my neck, and he's like, your neck's just tight. It's in a spasm. He's like, you need some acupuncture and some massage work. And I've had chronic stiff neck issues for years. But I was like, something's wrong. And I already had been diagnosed with autoimmune disease. I have psoriasis and Crohn's. And I was like, this is probably Hashimoto's thyroiditis, because when you have one autoimmune disease, you're predisposed to have a second, a third, fourth. And so I was like, this is probably autoimmune thyroid disease. So I asked my husband to run labs. I told him what labs to do, and he ordered like a full thyroid panel. And the labs didn't make sense. Like with Hashimoto's, you see a certain pattern that I didn't have. And I was like, this is weird. And I could still palpate this nodule. And so I was like, I want an ultrasound. So they did an ultrasound of my neck, and I had a 1 centimeter nodule. Now, the rule is if it's bigger than 1 centimeter, you do a biopsy. If it's smaller than 1 centimeter, you just follow it with an ultrasound. So I was like, something's wrong here. So I had a needle biopsy, and the result was Bethesda class 3, which means indeterminate, which means we don't know. But I was feeling worse and worse. And then I decided to look at my genetics. So I ran my genetics through this program called Promethease, where you can upload your raw DNA from something like 23andMe and look at genes that are associated with different diseases. And I had a gene that was associated with a 9 times increased risk of thyroid cancer. And, I told you that previously, before I went to med school, I worked with uranium, and radiation exposure is also a big risk factor for thyroid cancer. So I was like, I really think I should get half my thyroid taken out. Hopefully I don't need the other half taken out. I can, live without needing to take thyroid hormone the rest of my life. So I went to go see a surgeon that Chris worked with. And I went with my aunt, and he looked at me and he said, I see nothing wrong with your neck. And I showed him where the nodule was. And he felt that. He's like, there's nothing there. You're a hysterical female. You should get an ultrasound in a year. And I was like, wow, and I actually thought, am I crazy? Am I overreacting? And I was like, no, something's really wrong. So I went to a second physician, and again, I presented my labs, my information, what was going on. He's like, oh, this is just a goiter. You should take iodine. And if you take iodine, it'll go away. And I was like, something's wrong. So I finally went to a third doctor, who was also a colleague of Chris's. He was a thyroid surgeon at the University of Miami. And he didn't think it was a big deal, but he's like, okay, look, I'll do a hemithyroidectomy, which means, they take out half your thyroid. And by this time, like everything had been delayed by like 3 to 4 months. So they did the surgery, they removed half of my thyroid, and multiple lymph nodes were involved. It was like a super aggressive, undifferentiated cancer. And everybody was shocked by the pathology report except for me. And I was not happy that I had cancer because I didn't want that. But the level of frustration, and I mean, this all goes with throat chakra stuff, right? Not being believed. But I think so many women are dismissed by their physicians, and especially somebody like myself who's educated, who has an MD, who already shows up with the, even too, Jeannie, when I tried to present the genetic stuff to doctors, they didn't know what it was. And they weren't interested in learning or looking at it. And it was so frustrating for me. But I don't know. And Chris didn't think it was that I had cancer either at first.
Didn't look like it.
Yeah.
From the strict conventional medical standpoint, my colleague who did her surgery was like, look, I'll do this for you, but I don't even think you need it. That was his attitude. Like, he really didn't. And this is someone who takes out thyroids every day for a living. I mean, like, that's his thing. I don't know how many and if I have to send someone for a thyroid surgery, I refer them to him because he's so good.
He's excellent. Because
he's an excellent surgeon, and he's a very, very nice guy. But even he was like, he's like, no, we're probably not going to find anything here. He's like, you'll live with half your thyroid. It won't be a big deal. But then, turned out to be a very big deal where you had to go back for a second surgery and then get radioactive iodine. And it was like, okay, it turned into from not a big deal to, yes, big deal. Good thing you did that. But yeah, it was, when you don't have these other parts of the picture as far as associations and other sorts of factors that are involved in something as complex as cancer, if those things aren't in your mind, you don't see them. Like, they just they don't exist.
Like, for example, there's a higher association of people with autoimmune disease getting cancer because there's so much immune dysregulation. And I don't know if you're aware of this, but a lot of the newer cancer treatments are actually immune modulators and stuff like that. So I mean, and this is a functional medicine concept that most functional medicine docs are aware of. But most of the time it's like, okay, you have Crohn's, you go see the GI doc. That has nothing to do with your thyroid cancer. But when you have these chronic inflammatory processes going on, it really does predispose you, and especially when you have. And I mean, I tried to talk to people about the uranium exposure, and the lack of training about awareness of how occupational exposures can affect health. It's horrendous, honestly. Yeah.
It's interesting. It's something that I really would like for us to break down here too. So, well, first of all, are you well?
Oh, there's layers.
You're better.
But you're better. Yeah.
No, I mean, I go to work every day. I function. I get tired. I do have a chronic Lyme infection that I am dealing with, and I also have one of the weirdest heavy metal toxicity labs that we ever seen. Weird. Yeah.
Where are they?
And I also lived in China when I studied acupuncture. So part of it could be China, part of it could be from the lab.
Oh,
yeah. So and my
one of the things you're both highlighting, which is I think is really, really important. It's not necessarily a black and white conversation. Is you have to take in the whole being, the whole experience, and use that information to help make informed decisions around what's the appropriate care, what's the appropriate action. But I also think what's really important, I know we're going to get into this, is how important listening to your body is. And you were really an advocate for yourself. You knew something was off, even though you were surrounded by experts that were like, you're good, you're fine, you're fine. So I think that is one thing that I'd like to just highlight is really listening to your body. That's very much what you are encouraging, what you're teaching, what you're supporting in your patients. Because I'd love for us to talk about the practice that you have established in Miami. Like, talk to us about what it's like and what you're seeing right now.
So, yeah, and there are layers to wellness and illness, you know, and a lot of times when people come in, it's like peeling an onion. You know, they'll come in for anxiety, and, you know, Chris will end up fixing their gut. They'll come in for joint pain, and we end up detoxing them from heavy metals. And so since we're looking for root cause of illness, like the analogy that we like to use, there was this fantastic doctor, his name was Dr. Sidney Baker. He's kind of like the grandfather of functional medicine. And he has what he calls a 2-tack hypothesis. So if you're sitting on a tack, your butt's going to hurt. If I give you an Advil, maybe you'll feel slightly better, but the treatment is really to pull the tack out of your butt. Now, if you're sitting on 2 tacks, if I pull out 1 tack, do you feel 50% better? No, because you still got a tack in your butt. And the truth is, most of our clients have about 15 tacks they're sitting on. You know, there's an allergy to gluten. There's been exposure to a toxin. They're eating processed foods. There's a ton of plastic that's
vitamin D deficiency,
messing up their hormones. Yeah, nutritional
deficiencies of all kinds.
Yeah. Genetics play a role. Certain people, because of their genetics, will need higher amounts of certain vitamins in order to detox. There's so many levels of stuff that we look at. And so
what's the first step? So they come in, they see you. You also shared with me that you're their like 20th call. They're completely exacerbated. They're frustrated. They're up to here. So walk us through, you know, they engage you. What happens?
So, I mean, you know, we have 2 categories of patients. Like, I mean, we do have some people that'll come in and they'll say, you know what, I don't want to see a conventional doctor. I want to see someone who thinks outside the box, and like, maybe they have some minor complaints or what they view as a minor complaint. They don't have
that's me. Yeah.
Like, I don't have autoimmune disease. I don't have cancer. I don't have, you know, ulcerative colitis. You know, they don't have any diagnosis, but they're like, maybe they just don't feel good. Like, I'm fatigued, I'm tired. And with those patients, you know, you often find, I always tell people too, when I do a workup, we never come up empty.
Well, you do.
I will find something because everybody has something all the time. That's the trick. It's actually like, so you will find that everybody has something out of balance. Nobody's in perfect balance all the time. It's just a matter of how well we can balance these things out to really, you know, make you optimally healthy today. And then we keep watching over time because it changes. But, you know, usually it's folks who've been to several specialists. They've received diagnoses, and either they don't want to proceed with the treatments that they've been offered because they don't feel like it's worth the risks, or they don't feel like it's going to work, or they've tried the treatments that they've been offered and they haven't worked, or they've gotten a little bit better and then, you know, have not improved as much as they'd like. So, you know, we always start with a very, very thorough history, starting from like childbirth. Like, how was your mom's pregnancy with you? Did she have any problems during pregnancy? Was she diabetic? Were you born, you know, after 42 weeks, you know, like, or were you born severely premature, you know, and you spent 6 weeks in the neonatal ICU?
Were you breastfed?
Were you breastfed?
That sets your gut up the rest of your life.
How many doctors ask a 45-year-old person if they were breastfed when they were a baby? It's like unless you're a functional medicine doctor, very few do. I mean, but for us, it makes a difference because that sets up your microbiome, you know, the flora that live in your GI tract and your immune system for the rest of your life. Or if you say, well, my mom, you know, she had lupus, and she had a bad lupus flare when she was pregnant with me, and, you know, she was in the hospital for the last, you know, 8 weeks, and, you know, they had to induce her because she was getting, you know, severe preeclampsia, blah, 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 blah. I'm like, okay, that's going to set you up for some stuff in life. I mean, it's not insurmountable, but it helps me think about things. The other historical thing I find that we do that's a little unique as functional medicine docs, because I'm not saying, when I say we, I mean, this is the big we, not just me and Emily. Lots of people can do this work, but we always talk about environment and where you live. Where did you grow up? What kind of activities do you do for fun? What kind of work do you do? What kind of hobbies do you have?
Yeah,
Remember
and this
that
makes
lady?
me think of, I had a client,
Yeah.
she was very health conscious, and she had migraines from the time she was 5 years old. And she had a really rare aggressive breast cancer when she was in her early 30s. And she had like trigeminal neuralgia, and she was really just struggling. And I was treating her for about 5 years. And then she told me, when I was 5 years old, I lived down the street from the Monsanto factory, and I had these debilitating headaches. And they took me to Mass General, which is like, the big hospital in Boston. And I was inpatient there for a full workup, and they couldn't find anything. And it was like...
5-year-old kids don't generally get migraines.
Yeah.
Debilitating migraines. 5-year-old kid with debilitating migraines living down the street from a chemical plant.
And we started doing then, and then all of a sudden everything just came together. But it took 5 years for her to tell me that piece of the history. And this was because, I was mostly doing acupuncture on her, and we were doing other stuff, but all of a sudden, like, the pieces of the puzzle came together, and we did aggressive detoxification with her, and she got significantly better. Like, all the trigeminal neuralgia went away. It's fascinating. And I think, sadly, all of us are being exposed to chemicals that we don't even have ideas about, or some of them we don't even know how to test for.
Yeah, that's true. The other big ones we always talk about are water damaged buildings. Did you live in a place with a leak? Did you live in a place that had a leaky roof, leaky faucet, leaky sink, leaks in the hallway? You had to have a bunch of stuff replaced. There was, and of course, just as was there mold there, And most people look at mold as, well, it's an annoying thing. Yeah, maybe you can be allergic to it, but mold can also be toxic. It can have mycotoxins, toxins that are secreted by the mold. And a certain percentage of the population is highly sensitive to them.
Just based on genetics.
Based on, certain genetics. Mm-hmm. And mycotoxins are associated with just the entire list of chronic medical problems. You name it. There's, depending on the toxin, it can cause everything from, inflammatory bowel problems to neurodegenerative diseases to cancer. So, but if you don't ask someone that, and the other thing is too, when people think about mold, they think about, I lived in this dingy old building, it had this gross cellar and it smelled bad. Some of the worst mold cases I've seen came from very fancy buildings, multi-million dollar places that were full of mold. And
just to that point, I'm kind of curious when you think about just since the pandemic started, since March 2020 to now, right? Yeah, yep. March 2020. I'm completely still immersed in it. Do you find that you're getting weird and unusual cases?
Well, a lot of people are spending more time indoors, and if your home is toxic, it can be an issue.
Yeah. If your home's toxic, that's a problem. There has been a little bit of a shift, but I think we're a bad reference point for weird illness because we always see.
Yeah,
you are the weird illness.
We specialize in weird.
We specialize in the weird consult. And the other exposure, of course, we always talk about is tick bites, insect bites. Spending time in places where we know there's lots of Lyme, although there's Lyme in all 50 states, so you don't have to be, in Massachusetts or Connecticut to get Lyme disease. You can get it anywhere. People will often have these histories and they don't really remember these things. And when we talk about Lyme, I'm really talking about the whole category of stealth infections that includes other things that are related to Borrelia. If you don't ask about those things, you don't know. And
I think that's a really key differential here is you're very focused on the history. You're not just treating a moment in time and going forward. You're really looking back to say all of those things have contributed to this moment. What in that history do we need to know about to really help you? Which I also would love to hear the modalities, because I think your modalities and your approach to this is so fascinating.
Well, and here's the thing, no physician or healthcare practitioner, because that includes the PAs, the nurse practitioners, none of them want to hurt a patient. They all want to help people. Nobody goes into this unless, and even if it's some egomaniacal, hey, I want to cure you, they all want to help you. But because of the way the system is set up, the average doctor visit lasts 7 minutes. So our first visit here, because we don't take insurance, is 90 minutes. So
a lot of that takes time. I mean, just the history.
It takes time.
Just taking your history takes me a half hour. And what I'll tell patients too is like, look, you and I could go spend a long weekend in Bimini. I don't know if you've ever been to Bimini. It's a little island right across here in the Bahamas. Like, Bimini's really great. It's a beautiful little island, like nothing to do except the casino if you want to go to the casino. But so you're sitting on the beach with someone for 3 days, and I'll still never know your whole life. It's like, how will I know your whole life in 3 days? Your life is obviously much longer than 3 days. So I still can't know all of you, even in 3 days. So in 30 minutes, even that's a stretch. So we try to hit the highlights.
Well, and that's the beauty of acupuncture. A lot of the clients will see both Chris and I. And, when they come every week for acupuncture, I get like a little piece of the puzzle, like, because we'll talk for 15 minutes, then I needle. And then when the needles are in, things come to people. So like, and then all of a sudden they'll be like, Chris, guess what? So-and-so told me this. And he's like, oh, that makes so much sense.
They didn't tell me that. Like, well, we didn't have time.
But I mean, there's there's so many layers and complexities to people's in their lives. And like the Monsanto story.
Yeah. So the detailed history and a very good physical. I mean, we really do an actual physical exam. We put our hands on people and listen to them and, do the whole physical exam. And there's energetic portions of the exam too that we do, looking at the tongue, looking at pulses, looking
Chinese medical facial diagnosis.
Oh, facial diagnosis is so useful.
We both studied facial diagnosis.
Yeah. So in addition,
tell me a little bit about that, because that's pretty cool.
Well, it's very
really
useful.
Cool. It's
very useful. So basically, different meridians are reflected in different parts of the face. So you can see different problems. For example, the liver is associated with the eyebrows. So you can look at somebody and if their eyebrows are extremely thin, they've often been exposed to like chemotherapy. So I don't know if you've ever known somebody going through chemotherapy and their eyebrows fall out or something like that. And so you can assess different parts of the face, and it tells you the energetics of different meridian systems. And sadly, the lady who we studied with, she died just recently. But she was a fantastic mentor for us. Yeah,
Lillian Bridges. She was a phenomenal teacher.
She has a book that's great on Chinese medical facial diagnosis.
Mm-hmm. I think I'm going to be getting that book.
Yeah, you'll love it.
I find that fascinating. As somebody I study people for a living, I'm listening and watching and helping people to adjust. So I'm going to be all over. Thank you for joining me for another episode of the Warriors at Work show. If you are interested in learning more about what we do at the Warriors at Work show and platform, be sure to go over to my website, Jeannie Coomber, and subscribe to my monthly Warrior Playbook newsletter. I share everything that I'm up to month by month, as well as some lessons and insights that I've learned. I'm also interested in hearing any feedback you have about this conversation or future topics. So reach out to me directly on jc@jeanniecoomber.com or on LinkedIn. Be sure to tell your friends and your colleagues about this Warriors at Work conversation. Subscribe, review, and rate us. It's the best way to get this message out into the world. Be well.